A 1-month-old baby is among 5 children who are currently being treated for complications of the COVID-19 virus at the hospital. Senior Pediatric Emergency Medicine Specialist at the North Central Regional Health Authority, Dr. Joanne confirmed the data during Wednesday's COVID-19 health update.
We have one 1-month-old, a 2-month-old, 8-year-old, 12-year-old, and also a 2-year-old. So we have 5 children presently in the parallel healthcare system.
Paul said the virus is now affecting 2 groups of children, one of which is babies and those with chronic diseases.
So we have the babies who are less than 1 year. They're the ones, if they get COVID, they're the ones who we have in the ICU and HDU. And also we have the ones with the chronic medical conditions. So we have the ones who are, for instance, renal, kidney disease, heart disease, diabetes, even thyroid, immune issues, and also obesity.
The second group includes asymptomatic children, who Dr. Paul describes as having incidental COVID. Since the start of the pandemic, a total of 342 children have been admitted to the parallel healthcare system to be treated for the virus. Trinidad and Tobago has the highest number of multi-inflammatory syndrome in children, MIS-C, cases in the Caribbean, with 76 recorded in total to date. But Senior Pediatric Emergency Medicine Specialist at the North Central Regional Health Authority, Dr. Joanne said none of the children have died from the virus. There had been a plateau in the cases during late November and December, but Dr. said the numbers have begun to climb. She also noted instances of encephalitis in children. Encephalitis is the inflammation of the active tissues of the brain caused by an infection or autoimmune disease.
Now, the post-COVID brain inflammation or encephalitis. So we're seeing, again, about 4 weeks afterwards, we're seeing an increase in those numbers. I already mentioned before that with COVID, it can have receptors and it can attack the brain, the heart, and also the GI and other places. So we're seeing that now in terms of brain.
Dr. said children with MIS-C are often asymptomatic, which makes diagnosing their complications difficult. But she said the vaccination has had a drastic effect on MIS-C cases.
Developed MIS-C. So far, since August last year, since we started to have vaccinations for that age group, none of those patients have developed MIS-C at all. And it's a similar trend with regards to the post-COVID encephalitis.
Meanwhile, Minister of Health Terence D'Alsing said bilateral talks with Pfizer continue as this country seeks to acquire vaccines for the 5 to 11 age group. He said the COVID-19 manufacturing company has to send a heads of term agreement to the ministry before a contract can be drafted to obtain the vaccines. In the interim, CARPHA is developing an agreement to service CARICOM member states.